In this video, I will talk about longevity drugs which are available in pharmacy and very low cost, very low prices in Thailand. You can get it online, you can buy it online or in local pharmacies very easy, and then they make miracles. So we can use it again for rejuvenation of our body. Let's go. And as always, I recommend you to download this presentation as PDF file from the link in the description. You will get to the source of information, to the links. You can make your own research because I'm not medical professional. I'm not supposed to give you medical recommendations. I'm doctor in physics and mathematics, but I do this research for my own rejuvenation, and I'm supposed to live much longer, probably to 1,000 years. Okay, let's see how it will go. For now, I am quite happy with the results and rejuvenation goals, but unfortunately slow. But everything in biology takes time, so I cannot expect to see rejuvenation overnight. Okay, the phrase "you are as old as your arteries" attributed to the 17th century English physician Thomas Sydenham reflects the link between arterial stiffness, aging, and cardiovascular risk. See my video and presentations to go in more details. Arterial stiffness, particularly in large arteries such as aorta, increases systolic blood pressure, while after the age of 60, often reducing diastolic blood pressure. These changes lead to elevated pulse pressure, which is the difference between systolic blood pressure and diastolic blood pressure. And normal pulse pressure is around 40 millimeters of mercury considered, and pulse pressure exceeding 60 millimeters of mercury is often considered elevated. Elevated pulse pressure is a key marker of vascular aging and significant risk factor for cardiovascular disease. Okay, so here's the definition of the pulse pressure. It is difference between systolic blood pressure and diastolic blood pressure. Systolic blood pressure is maximum blood pressure, and diastolic blood pressure is minimum blood pressure in the large arteries. Okay, so it can be very easily measured, and then there were many measurements, and you can relate pulse pressure, for example, to biological age of the cardiovascular system. So you see, of course, some people, these four groups of people, some people physically better and than others. So, but at least you can estimate your biological age if you know your blood pressure. And blood pressure 30 is in young age, 30 here 37, and it corresponds to age 30 for all groups. And for now I have pulse pressure like 37, about the same like here. So, and at least I can think that I have biological age maybe 45, or maybe younger, and again that's what I try to do. I try to reduce my pulse pressure even more, because in age of 18 I had pulse pressure only 30 millimeters of mercury, and you see that the systolic blood pressure is increasing, diastolic blood pressure after age of 60 decreasing. This leads to increase of the pulse pressure. Elevated pulse pressure increases the workload on the heart and leads to a greater risk of damaging capillaries in vital organs such as brain, kidney, liver, and lungs. Elevated pulse pressure is associated with increased risk of overall mortality in variety of populations. You can go, there are many research on this topic, and you can read and see that it is so true. As I discussed in my videos, you can go to these videos, watch them again, and presentation, pulse pressure and resting heart rate serves as non-invasive indicators of arterial stiffness, and this also related to biological age of the cardiovascular system and mortality risk. Interventions such as aerobic exercise, in difference from anaerobic exercise, strength exercise. Strength exercise normally increases pulse pressure, but aerobic exercise decreasing pulse pressure. So also dietary modifications, antihypertensive medications, some antibiotics, and specific lifestyle changes, like better sleep, including following appropriate diet. Again, dietary. Okay, I made it 2 times. Okay, proper diet. I mean this. For example, if I follow the modified carnivore diet, and plus prebiotics and probiotics, and also I do aerobic exercises, it can help lower pulse pressure and reduce associated cardiovascular risk. Okay, so here also the heart rate, how heart rate defines mortality risk. So if heart rate is below 60, then for women and for men, the mortality risk from all causes is relatively low. And I have my resting heart rate is about in range of 48 to 52. So it's again here. So mortality risk for myself is low. It's below 10% for men. Okay, what we can do again to improve health of our cardiovascular system and reduce biological age, we can use some antihypertensive drugs. For example, losartan has several advantages for the cardiovascular system. It is reducing arterial stiffness, which is again surprising. It also limits remodeling muscular aorta, because it is slow down destruction of the elastin fibers, and also prevents development of fibrosis and hypertrophy of the wall of the aorta. It improves arterial compliance, so it is make arteria softer and improves elasticity. It is soft and elastic, and this altogether it is reducing systolic blood pressure and pulse pressure. So also it has anti-inflammatory and neuroprotective effects that improve vascular health and protects kidney by lowering pressure inside the kidney, especially in patients with diabetes or chronic kidney release. Okay, this even without change of the diet, it has some positive impact on your health. So the drug spironolactone was investigated. Also, it is diuretic, and it used to treat high blood pressure. It's very common, but it has also anti-inflammatory properties. And treatment of elastin deficient mice with combination of losartan and this diuretic decreases collagen content in the aorta to make it aorta softer, and then but problem that the side effect it is not good for men, because it is feminizing effect for men, so it's not good for men to use it. Okay, then again, risk reduction in placebo group compared to placebo group and losartan, and this is the percentage of patients with hospitalization because of heart failure. So if the people take 50 to 100 milligram of losartan, and placebo, compared to placebo, losartan reduced the risk of the hospitalization. So it is actually helpful. In this presentation, I will discuss the use of some also another hypertensive drug, which is hydrochlorothiazide instead of this spironolactone. They are both diuretic medications, but this has less side effects. And this hydrochlorothiazide reduces pulse pressure reduces pulse pressure because it normally works on systolic blood pressure, not diastolic blood pressure, and it is decreasing vascular tone by reducing sodium content in vascular smooth muscle cells. So it is again protects organs such as brain and kidney by reducing hypertension and induce damage in these organs. So long-term, 1 year use of this antihypertensive drug improves arterial elasticity and endothelium functions, which is again quite surprising in a result. Trials show that significant pulse reduction, which is 8.6 millimeters, again with no other interventions, with no change in the diet and no change in lifestyle. So it is again, it is compared to other hypertensive drugs, like you can check what are the drugs, beta blocker and calcium channel blocker, and so it is again, you can go to the publication, read, and so it's again first when you started to treatment in first months with the use of 25 milligram once a day of hydrochlorothiazide. 25 it is too much, maybe 12, half of this beta, it's I believe, but okay, here was done with 25, and then this spironolactone in 1 month gave better results, but in long term it was beta, and also it has this hydrochlorothiazide is suitable for men because it has no side effects. Okay, you see here the change in pulse pressure, which is again quite surprising. So it's changes in the blood pressure indicate that the change in biological age of the cardiovascular system. So somehow hydrochlorothiazide somehow is actually rejuvenate people after 1 year. After 1 year, it's quite surprising rejuvenation. So just with this very cheap and very easy available antihypertensive drug. So, but more than this, a combination of this antidiuretic and losartan provides complementary mechanism in action with synergistic effect. Okay, that's this diuretic drug lowers systolic blood pressure because it is somehow mechanism. People believe that it is reducing blood volume, but what else? Maybe something else. While pardon, here I didn't change. It has to be losartan. Okay, no, losartan. Okay, just mind that this is losartan. And losartan increases arterial compliance, so it makes arteria softer, and through the vasodilation and reduce arterial stiffness. And losartan counteracts with calcium depleting effects of this diuretic and improves renal protection in patients with comorbidities by minimizing electrolyte disbalance in balances in kidney. Yeah. So together they address systolic hypertension more effectively than every drug alone. So it is synergistic, they work synergistically. By targeting arterial stiffness, this therapy helps mitigate cardiovascular risk, enhances quality of life, reduces drug cost, and supports long-term vascular health. Observational studies have demonstrated significant reduction in both systolic blood pressure and pulse pressure using a single tablet combining losartan 50 milligram and again I will change in the presentation. The losartan 50 milligram and this hydrochlorothiazide 12 milligram. So this is standard, and the losartan is more standard 25 milligram. But okay, so this was a trial, and then somehow it worked much better than every drug alone. So then we come into the gut dysbiosis, because the health of your gut is directly related to your longevity and directly related to your health, especially in old age. So gut dysbiosis is defined as imbalance in the gut microbiome, characterized by the decline in beneficial microbes and accumulation of harmful pathogens. And this is increasingly recognized as an important aspect of aging, maybe the main aspect of aging. It happens, of course, we can discuss it. It's I believe that one aspect of aging is the stiffening of blood vessels, but also gut dysbiosis may be second most important reason, most important parameter of aging. A disrupted microbiome can impair the production of short-chain fatty acids like butyrate, which play a vital role in gut health, inflammation control, and cellular energy metabolism. Again, some people who promote the carnivore diet, they tell so that okay, we don't need fibers. Yes, right, we don't need fibers, but we can use other other substances like this pure starch from cassava and potatoes from tubers, and we can consume them to improve the microbiome. But okay, again, it's very important. While these proponents of eating only animal-based products, they are correct, but it is improving health certainly. But to live longer, it is not enough. To live longer, you need also prebiotics and probiotics. So okay, and so dysbiosis will kill you anyway. So because of over time, you will get dysbiosis even if you eat only animal-based products. Okay, dysbiosis can compromise the integrity of the gut barrier of the epithelium layer, allowing bacterial endotoxins, for example, lipopolysaccharides, to enter the bloodstream. This triggers systemic low-grade inflammation, a condition commonly referred as inflammaging, which contributes to the development of age-related conditions such as cardiovascular disease, neurodegenerative disorders, type 2 diabetes, and arthritis. Okay, studies on centenarians, people who live more than 100 years, reveal that a healthier gut microbiome is associated with better health and longevity. Okay, so here again, what we have, the microbial dysbiosis drives systemic inflammation, okay, because it is targeting mucosal barrier. Mucosal barrier, it is additional protection of the epithelium layer in the gut, and then this barrier, this gel, is produced by some cells in the epithelium, and but to produce these cells, to produce this gel, you need you have to supply some food for these cells. Gut microbiota dysbiosis may also disrupt bile acid metabolism, leading to increased oxidative stress, mitochondrial dysfunction, epigenetic alterations of critical genes, especially in the epithelium layer, and also cellular senescence, both in epithelium layer in your body also. Dysbiosis can influence the gut-brain barrier, promoting neuroinflammation and contributing to age-related cognitive decline like Alzheimer's disease and mood disorders. Okay, again, mechanism quite obvious. So if toxins are getting through your epithelium layer and to the bloodstream, then they are getting to the brain, can get through the blood-brain barrier, and then they produce chronic inflammation in the brain and central nervous system. Research suggests that dysbiosis contributes to impaired immune function and a range of age-related diseases. Okay, so not only the brain but also the immune system overloaded and also compromised in this case. Dysbiosis negatively affects the gut-associated lymphoid tissue, a critical component of the immune system. Again, much of your immune system is concentrated around your guts. So you have to pay much attention to this. So resulting in immune dysregulation drives systemic autoimmune diseases, reducing the body ability to combat infections and increases susceptibility to chronic diseases. So managing dysbiosis through dietary and lifestyle modifications like probiotics, prebiotics, and some antibiotics can support healthier aging. So again, you see here connection between brain and your gut. Gut dysbiosis creates inflammation and in the not only in your body but also in your brain. And again, what we have that's changes in gut microbiome is changing or your it is results in inflammation in so-called inflammation and accelerated aging. So it is your gut as a very important, maybe as I said, second in importance factor after stiffening of the blood vessels and stiffening extracellular matrix in your body. Again, surprisingly, doxycycline, this antibiotic, doxycycline improves dysbiosis because it kills mostly pathogens, but not so many, but the beneficial bacteria like lactobacteria can survive. It also compromises, it is reducing number of beneficial bacteria, but this bacteria you can get to your gut by eating fermented dairy products, for example, and it's in principle you can improve your microbiome by supply of this beneficial bacteria from outside. So again, somehow very interesting that consumption of doxycycline reducing blood pressure. Doxycycline as antibiotic, but it is reducing blood pressure in rats. There was a model of rats with high blood pressure, but doxycycline somehow changing the blood pressure. It makes it normal. This is a blood pressure of not treated rats, and here it is not with rat with hypertension, and then doxycycline is make blood pressure normal. So again, in my video and presentation, I discussed the use of some antihypertensive medications like losartan. This already forgot. So you can click on it. It is pardon. Don't keep in mind spironolactone. Spironolactone. I was talking about spironolactone already, and also minoxidil. Interesting. So minoxidil is mostly used to grow hair because it is blood widening. It dilutes blood vessels. So, but again, interesting. So they can be used, but especially in combination with antibiotics like doxycycline and minocycline. These are very popular antibiotics, very relatively cheap. Minocycline is less common and more expensive. The doxycycline is very cheap, at least in Thailand it is so. So again, it can be used in combination of these drugs, and it is what is measured as a life extension. We can maximum life duration in mice was measured with these drugs, with these interventions, and doxycycline. This also gave very astonishing results. Okay. Doxycycline is a tetracycline class antibiotic, which is bacteriostatic. It works by preventing bacteria from reproducing through the inhibition of protein synthesis. It has also properties that can be beneficial for addressing dysbiosis and related systemic effects beyond this antimicrobial action. So doxycycline in low doses, 20 to 80 milligrams per day, has anti-inflammatory effect and improves endothelium function in the blood vessels and inhibit degradation of elastic fibers in the blood vessels by these enzymes which are called metalloproteinases. So metalloproteinases, they destroy all fibers. They destroy elastin fibers, they destroy collagen fibers. So that if they are very active, then collagen fibers are destroyed, and then your body tries to repair this damage and make increase of the smooth muscle cells and also increase of the thickness of the wall of the aorta and other arteries. So it's really interesting. So, but doxycycline somehow suppress the release of these enzymes, metalloproteinases. So it is again, it gives protection to the people with hypertension. So okay, well, let's see. This is untreated mice, and mice that are getting doxycycline and minocycline were living maximum lifespan was much longer. So it's again compared to this, it's more than twice. Doxycycline in extended longevity more than twice. So it's really interesting fact. But combination of doxycycline with losartan gave some fantastic result. Again, even maximum lifespan was not measured because again it was too long. So the results were. But if we check survival rate at a level of 90%, you can compare that combination. You can see that combination of losartan with doxycycline gave, in comparison with not treated mice, it's changed like from 5 to 32. So it's more than 6 times maximum. The longevity increased more than 6 times. It's amazing. Also, a combination of losartan and doxycycline, it reduced number of breaks of elastin fibers, so it is keeping elastin fibers intact. So you see here, it is working much better in comparison with not treated. This is healthy and this is not treated. Okay. So other also publication was the compared the structure of this aorta wall was measured with control. It is healthy rat, and then rats with deficient in elastin fiber production, they have very low content of elastin fibers. But the same animals, if they were getting losartan and doxycycline, somehow developed so many elastic fibers. It's incredible. So it's again quite surprising that this combination of losartan with doxycycline increased production of elastin fibers. This because elastin fibers in humans, they stop to grow after age of like 25, but somehow this combination, we can expect this the use of this combination of just losartan and doxycycline may improve the elasticity not only of your arteria but also in all your extracellular matrix, probably your skin. Over time it can work. So it's again it takes time, 9 months. The duration of this research was 9 months. So it's certainly for humans it's even longer. You have to see the improvement, but yet it is very surprising effect. What else? Vascular smooth muscle cells, they can transition from inert phenotype to cells which are move and proliferate. This again, this impacted by action of these enzymes, metalloproteinases, and their interaction with extracellular matrix component. Okay, again, doxycycline suppress the hyperactivity of these enzymes, and it may shield against these structural changes linked to hypertension and stop these changes. Okay, it was the research was 8 weeks. Doxycycline was administered to hypertensive rats, and the systolic blood pressure was increasing but slowly in doxycycline treating rates is compared to the controls. Also, independently of this antihypertensive effect, the doxycycline prevented the structural alterations in the aorta, such as increases in aortic medial thickness, arterial stiffness, and vascular collagen content. This again here, this slide demonstrates what is happening. So if extracellular matrix destroyed by these enzymes, then this vascular smooth muscular cells they multiply, and the result that this aorta gets very thick, thickness very old. This actually your body tries to protect you from the damage, and if collagen and elastin fibers are destroyed by this metalloproteinases, by these enzymes, then the reaction that this muscle cells, smooth muscle cells will multiply and increase thickness of aorta, and to avoid a rupture of this aorta and your death. So it's again, it is kind of protection, but it leads to high blood pressure. So it is actually not very nice. But if you take doxycycline will stop increase in this thickness of the wall, and actually improves the blood pressure, improves your blood supply. So doxycycline is a non-specific inhibitor of these metalloproteins, and was compared with another antihypertensive drug, which is atenolol, this diuretic. This is a standard beta blocker for hypertensive therapy, and then it was compared in mice, and then again in mice, it's surprisingly it was quite interesting results. So it is suppressed this the increase of the thickness of the artery. So the chemical structure of this atenolol, chemical structure of doxycycline, they're completely different substances, but doxycycline worked much better. Okay, here again compared to atenolol, the long-term use of doxycycline is more effective in prevention of this destruction of the fibers. So in mice deficient in elastin fibers, the use of doxycycline improved somehow was related to production of the elastin fibers. So it's absolutely surprising result. So, and combination again, there was next step that a combination of losartan and doxycycline was used again in aortic aneurysm in mice, mice deficient in production in elastin fibers, and again it worked surprisingly well. It is worked synergistically, and so you see at this slide also the combination of this losartan and doxycycline worked so much better than mice with this deficiency of the elastin fibers. So here we have almost no elastic fibers, but only collagen fibers. So very stiff and very stiff artery, but here artery is elastic and soft, so it is but it takes long. For mice it takes 9 months, for humans it may take years, but it's surprising that it actually relates to rejuvenation of the body. So it's again normal experiments use this they cut aorta and make these photos in aortic this different here in different locations. They can cut it here or here or here, so it's again, you can see that, but at least all areas of the aorta are improved here. You see here aorta, this arc, so okay, you can see the structure. But okay, the result is such that again the combination works surprisingly synergistic. Then we can go to this bacterial dysbiosis. Bacterial dysbiosis second reason of the aging, because dysbiosis creates damage, results in damage of the epithelium wear and leaky gut syndrome, and then toxins and pathogens can get to your bloodstream, and actually it is also creates conditions of the inflammation in your body and accelerates aging. Surprisingly, doxycycline can inhibit the growth of certain pathogens without completely eradicating beneficial microbes like lactobacteria and bifidobacteria. By inhibiting this dysbiosis, doxycycline prevents cardiovascular pathology, improves gut barrier integrity, which is absolutely important, and attenuates hypertension. Again, in rats that were treated with some salt and to achieve hypertension. So again, doxycycline can reduce systemic inflammation linked to dysbiosis. Again, surprising results. I mean, quite surprising results. By reducing inflammation, doxycycline can help restore the integrity of the gut barrier and prevents translocation of these endotoxins, toxins produced by pathogens. These toxins like lipopolysaccharides into the bloodstreams. And combination of doxycycline with dietary changes and lifestyle interventions such as regular aerobic exercise or other microbiome modulating therapies can enhance outcomes. Co-administration of probiotics such as lactobacterian prebiotics such as resistant starch, which I recommend because it's so cheap, so easy to use. So it can help replenish beneficial microbes and support their growth and reduce the risk of dysbiosis in the gut. So it's again a very cheap, very affordable way to extend your longevity. And we can here see the effect of doxycycline in combination with some other antibiotic, but again, doxycycline itself works quite well. So if it is combined, maybe better, but okay, here combined work better than doxycycline itself, but maybe. But again, doxycycline is very cheap, easy to buy, and you can again, you see many benefits from this. And then again, we're going further, not only to the inflammation in your body and leaky gut syndrome. We are going to the problem with thymus. Thymus is a primary immune organ in the vertebrates. With age, the thymus undergoes so-called involution. Involution is characterized by decline in the thymus epithelium cells, increased fibrosis, and replacement of functional thymic tissue with adipose tissue. Sorry about noise. This is I'm in the village, and in the village sometimes very noisy. Okay, chronic low-grade inflammation accelerates atrophy of the thymus. So what is happening is this involution, it is changing in the size of the thymus, it is getting smaller over time, and also functional tissue is getting replaced by adipose tissue. This is that thymus senescence, and also more cells getting senescent. And doxycycline has the potential to attenuate this senescence, improve function through its anti-inflammatory, antioxidant, and immunomodulatory and antifibrotic properties. So it is again somehow it may enhance the homeostasis of these T cells in the thymus and indirectly benefiting the immune function. So it's again very cheap drug, easy to buy, easy to get. Surprising result. Okay, but yet again, safety and potential side effects of doxycycline require careful consideration. Maybe people have to get advice from medical professionals, but I don't do it, but I use very low doses of doxycycline, and if I have no side effects, I slowly increase the dosage, and so it can be. Also, there are many possible combinations to improve the action of the doxycycline. So maybe I will talk someday about this. So the aging of adaptive immune system results in the decreased functionality of which also called immunosenescence. So again, the involution of thymus leads to this the aging of adaptive immune system. The thymus, the primary immune organs in vertebrates, undergoes involution with age, characterized by decline in the epithelium cells, increased fibrosis and replacement. So I repeat it, but actually it is just I took it from this publication, so you can read it. It is quite common knowledge. But again, what is surprising, the doxycycline attenuates this senescence of and involution of this thymus. It is rescues the thymic function and promotes reconstruction of the T cells and protects the thymus epithelium cells from early stages of apoptosis. So it's again low dose doxycycline decreases systemic inflammation, improves glycemic control and lipid profiles in mice. So quite miracles in mice, but again in humans also there were very interesting results. Doxycycline is frequently used. It is very common medicine. It is again cheap and easy available. And the efficiency of the oral doxycycline is not based only on antibiotic properties, but also on this anti-inflammatory and angiogenic, so anti-senescent properties. The biological half-life of the doxycycline in up to 22 hours, so taking doxycycline once a day is more than enough. So also it is important to consider the use of doxycycline to eradicate cancer senescent cells. Okay, we're coming to the third parameter. So we have stiffening of the extracellular matrix is the primary cause of aging. Secondary, it is dysbiosis in your gut, so the reducing the number of beneficial bacteria and increase in the pathogens. And the third one, is accumulation of senescent cells in your body. And somehow, again, it is if we will we will manage with these factors, we can stop aging, we can probably rejuvenate, and we can our body and probably live forever. And like what we can see in some bats and naked mole rats I was discussing, again, it's very interesting. So they eradicate these mammals, they eradicate senescent cells different way. But for us, we have already many senescent cells in our body, so we can eradicate, or we can contribute also to eradication of these cells with the use of antibiotics. For example, when doxycycline is combined with another antibiotic, which is azithromycin, and together with mega doses of vitamin C, it can work to eradicate cancer cells and stem cell cancer cells, and also the cells which are senescent cells. So it's again, it's a way. It's again have to be very careful. And I was talking about the use of this combination as senolytic. I tried on myself. I would say first result was quite fantastic. I got so much energy, more energy, but then next times what was not so well. Why? Because again, this combination kills not all senescent cells in your body, but it works mostly for some tissues like a deposit tissue or maybe your prostate gland, and but to eradicate everywhere you need maybe again something else like very intense aerobic exercise and plus diet changes in your diet. Exactly, it can be a point of research how to make to eradicate senescent cells, but again even this combination can be used. Okay, this was publication, you can go to read this, again very interesting. So combination of this of the vitamin C, azithromycin and doxycycline kills senescent cells. Okay, again, in this research, the impact of the diet on hypertension and oxygen delivery by blood to tissues was not investigated. But again, I would say more advanced in this approach. So, and I believe that it is important to note that consuming plant-based foods which are rich in phytosterols may lead to compromised oxygen delivery by blood to your tissues. So again, I stay on carnivore diet, with modified carnivore diet, which is rich in prebiotics and probiotics, and again with some supplements and vitamins and amino acids also. But I would say plant-based foods are not good for your health. Period. Okay. Avoid any plant-based foods, especially seeds and products from seeds like bread, pasta, etc. You can again you can ferment this and you can treat it like washing and this plant-based food, washing and and then eventually remove toxins from these products. Like for example, good example is potato starch. Potato starch is produced from plants, but it is all the toxins are washed out from it, so it has no toxins. Also, potato starch is from tubers. Tubers are much have much less of these toxic substances like phytosterols and other toxins in there, so it is relatively safe. And I propose to use this potato starch in large amounts to improve health of your guts, for example. But okay, we are coming that phytosterols and may compete with cholesterol. Again, in difference from medical professionals who don't understand what is cholesterol, they call low density lipoprotein, which they call it cholesterol. Cholesterol is a part of this LDL, but it is not the dangerous part. Cholesterol, we need cholesterol. Cholesterol is the principal sterol in body tissues, especially in the brain and spinal cord. It is absolutely critical for maintaining cell membrane fluidity and stability, and plays a role in signal transduction. Cholesterol also serves as a precursor for hormones like steroid hormones, adrenal hormones, and vitamin D. Additionally, cholesterol is precursor for bile acids necessary for the emulsification of fats, fascinating fat digestion in small intestine. So again, cholesterol, instead of recommending what medical professional recommend, they recommend plant-based food, and they recommend like green vegetables which are rich in phytosterols, and they recommend it for health to reduce consumption of cholesterol from animal fat, for example. So I'm not a medical professional, so I have my own opinion. My opinion based on science. Because I'm doctor in science, not in medicine. Medicine I consider business to make people sick, and get benefit and get some profit from this, keeping people sick and making them sick. And I don't use any help of the medical professionals for 25 years or longer, and I'm actually I tried to get some advice, but I discovered that no, it's absolutely useless, absolutely useless. Even the small advice that I used to have some insomnia, and I was asking what to do, and they gave me some drugs which are with very heavy side effects, and eventually I discovered that just magnesium can calm you down and improve your sleep. Okay, so cholesterol is absolutely important, and you can get cholesterol only from animal fat, only. So again, phytosterols inhibit the absorption of cholesterol from animal fat in the intestines. First, again, so why they are absolutely toxic? Second, high phytosterol intake might displace essential cholesterol in cell membranes, including in red blood cells, and potentially impairing their deformability. Again, these cells, the membranes have to be fluid, have to be very elastic, very easy deformable. And but blood cells, especially red blood cells, if phytosterols replace cholesterol in red blood cells, it is disaster. So again, this displacement of phytosterol could hinder oxygen delivery, especially in capillaries. Third, the excessive phytosterol intake might disrupt cell membrane lipid composition, potentially affecting endothelium cell function in the blood vessels. So they are losing this reaction. They cannot dilate. Epithelium health is critical for vascular elasticity and dilation. So accumulation of phytosterols in tissues leads to premature atherosclerosis and vascular stiffness, quite obvious. Some evidence suggests that phytosterols may increase platelet aggregations, which could affect blood flow and oxygen delivery in specific conditions and potentially increase the risk of strokes and heart attacks. Okay, in small capillaries, red blood cells, the size of red blood cells is larger than the size of the blood vessels of the microcapillaries, but they have to get through to deliver oxygen to these organs, to these tissues. And again, this oxygen delivery can be compromised by intake of plant-based food. About 50% of circulating cholesterol in blood is carried in red blood cell membranes. Again, this is why it is so important to have flexible membranes of the red blood cells. Red blood cells must remain flexible to pass through the blood vessels smaller than their own size, and consuming plant-based foods and using seed oils, especially seed oils, toxic. Avoid at any cost. And so use of seed oils for cooking increase the content of phytosterols and polyunsaturated fatty acids in the LDL particles. LDL particles, medical professionals call LDL particles as cholesterol. It is not cholesterol, it is lipoprotein. And if this lipoprotein has polyunsaturated fatty acid phytosterol, then disaster happens. Because first polyunsaturated fatty acids get oxidized, they are getting sticky, very sticky, and also phytosterols help in this. And then with this modification, then cannot be removed by liver from the bloodstream. They accumulate in the bloodstream, and eventually they go to the wall of the large arteries, and then you're getting this atherosclerosis, and with all the absolutely deadly consequences. Okay. Again, this phytosterols also replace cholesterol in cell membranes, not only red blood cells, but other cell membranes, making them stiffer and affecting their permeability to gas molecules. Again, you are getting the gas molecules, carbon dioxide and oxygen have to go both direction and through the membrane, And if you have a lot of phytosterols in the membrane, then you are damaging all your cells. So it's again this replacement of cholesterol by phytosterols compromise oxygen delivery to tissues through small capillaries, as I said, but also to other tissues, because if tissues have cells with compromised gas permeability, they also it develops hypoxia. Chronic hypoxia leads to accelerated aging and premature death. Membrane stiffness also lead to compromised migration of immune and stem cells through the gaps in extracellular matrix and failure of tissue maintenance. Again, very, very important. First, as I said, very important that stiffness of the extracellular matrix because of reaction of these glycation reactions is increased stiffness of the extracellular matrix. But then, if we will add to this stiffness of the membranes of the immune cells, then all maintenance of our body can be compromised, and this why people cannot live long. So this is so important to avoid plant-based food at all cost, with some few exceptions like the potato or cassava starch. Okay, what else? I already have some supplements, but I have yet some problems, like maybe I think too much, and I sometimes sleep not very well. So to improve my sleep, I sometimes take before bedtime antihistamines, because antihistamines they have some sedatory effect, and in small doses, of course, and I tried two antihistamines of the first generation, which are again very cheap, very easy to buy. This is Dramamine and the ketotifen fumarate. Okay, this I got it by online order. I ordered by online. It was delivered to my address. And again, they have anti-inflammatory properties because they stabilize mast cells. Especially what is interesting, ketotifen is suppressing the development of fibrosis in inflamed tissues, because it is suppressing the inflammation, and then fibrosis does not develop. So it's again quite surprising side effects, but which is very beneficial for health. And that losartan reduces vascular resistance and may reduce blood pressure. And other this diuretic, which is again I tried this hydrochlorothiazide, it is also reducing blood pressure. It is good, but combining antihypertensive with this antihypertensive drugs can be problematic. It can result in very low blood pressure, and so it is maybe some dizziness. So we have to be very careful about this. And then again, you will get some fatigue, lethargy, especially if you daytime. It's not very nice. So, to my opinion, again, if I take this if I take antihistamines, I take them at night because to sleep better, but antihypertensive I take in the morning. And this separation in time reduce daytime sedation and dizziness, and allows body to adjust to potential interaction of this drug. So again, I use quite some combinations of supplements, and you have to be very careful what time to take this or that supplement. Also, to improve my sleep, I take nicotinic acid or niacin before bedtime. Niacin plays a role in synthesis of serotonin, which is a precursor to melatonin, which regulates the sleep-wake cycle, and adequate serotonin levels support better sleep quality. Niacin also causes peripheral vasodilation. It's also good, which can induce a sense of warmth and relaxation in your body, potentially promoting sleep in some individuals. At least for me it works. Niacin may help reduce pre-sleep stress or anxiety. Niacin has been suggested to influence the secretion of human growth hormone, and taking it before bedtime may increase secretion of human growth hormone, and which is mostly go during the sleep, deep sleep in the beginning, particularly in the early stages of the night. And if niacin improves sleep quality, especially deep sleep, it indirectly support optimal release of growth hormone. Okay, so how it works? Again, it is quite not easy to understand because niacin is reducing circulating free fatty acid levels by inhibiting lipolysis in adipose tissue for about 3-5 hours, maybe 2 hours and a half. It's especially high, but then 3 hours after 5 hours, it certainly already stopped working. High levels of free fatty acids can suppress secretion of growth hormone. Again, you see it's again how it works. If you want to grow muscles, again, don't use growth replacement therapy, but just combination of with niacin or with some other amino acids can improve growth of your muscles, and you can relax, you can sleep better. So data suggests that high free fatty acids are important suppressor of the secretion of growth hormone in people with obesity. Yeah, so again, obesity is not healthy, but again, some obese kids, especially obese kids, cannot grow. And by lowering this free fatty acid level in the blood, niacin might create conditions more favorable for production and release of this growth hormone. Okay, after this 3-5 hours, there is a strong increase in circulating no, pardon. First we're talking about you take niacin, you have this flushing effect, and what is happening is strong increase in circulating cortisol and glucagon and growth hormone. So all together go up, your muscles grow, and also niacin is involved in the production of cellular energy, and then adequate energy availability in the cellular might support physiological processes, including secretion of high growth hormone. I was talking about the mega doses of this niacin, and niacin, I'm talking about nicotinic acid, not other substances, not NMN, not nicotine mononucleotide, which is expensive, and actually it ignites cancer development, so be careful. But okay, there is anecdotal reports. There was some clinical research, but also anecdotal reports about that large doses of niacin, 1 gram and more, actually 3 gram. 3 gram is recommended again, but go to this level slowly. They improve health, sleep, reduce concentration of free fatty acids, and positively influence release of human growth hormone. Okay, there was some trials and double-blind placebo-controlled trials, which is combination of niacin with glycine. Glycine, again, I take glycine before sleep, also helps to sleep better. Glutamine. Glutamine is I don't take it as supplement, but it can be you can get it from monosodium glutamate. Glutamate results in production of glutamine, actually. So it is the recommendation to avoid monosodium glutamate is wrong, to my opinion. But I use this monosodium glutamate to improve the food, how it works, and my dogs and cats love it, absolutely love it, if I use this monosodium glutamate. And I realize that I trust pets understand what is healthy. I tell you, they don't eat unhealthy food, but if you give them something healthy like beef liver, they're just absolutely crazy to eat it. I'm so happy. Beef liver is good for her health. Okay, then again, there was some trial that this combination was used for 3 weeks, and it increased concentration of human growth hormone 70%, so quite good, without a change in the insulin growth factor increase. Okay, this is again good, very good and interesting combination. So, and then also it was used in to treat kids with obesity, and again it is dose dependent. If dose is very small, it doesn't work. It has to be large dose enough, and also not once, but if it is used every hour, 3-4 times, 1 gram every hour, then it worked so much better. But also you have to be careful, because under name of niacin, nicotinamide is or extended release compounds of nicotinic acid often sold. Nicotinamide is okay, you can combine it with niacin, it is no problem, but these long-term drugs which has no fresh effect, and they are toxic to liver. So the use of large doses leads to toxicosis and then liver damage. So be careful. Niacin, again, to reduce this toxicosis, and even with niacin, you have to combine it with betaine or TMG, because otherwise large doses of niacin may damage liver. Okay, so it's again from the article that the use of this large doses of niacin, nicotinic acid, but again every hour, if it is taken every hour, then you see in large doses, okay, and large doses and every hour, then you see over time you see quite impressive increase in the growth hormone. So if you take it for night, for example, okay, you can take maybe 3 gram, but if you wake up to go toilet, you can take another dose, no problem. Okay, you can take another dose, and then it will, growth hormone maybe will be better, and muscles will grow even better. So you can go to the source of information, make your own research. I highly recommend to do so, because again, I'm not medical professional. I do this research for my own benefits. I want to live forever young. Let's see how it will work. But I'm quite surprised to see some benefits from what I'm doing, especially about dietary interventions that I use this modified carnivore diet, which is again many details. I don't talk about these details now, but again, what is important, that remember that large carnivore animals live much shorter than herbivores. They like lions and tigers. They live much shorter than herbivores eating grass. They not eat grass because it's actually, they have special structure of the stomach and with many chambers, and they actually consume this short chain fatty acids produced, and proteins also produced by bacteria. They live on these bacterial fermentation products. So this also shows the importance to produce the short chain fatty acids, but not from grass. I don't recommend to use grass, because again, you cannot produce short chain fatty acids from fibers. Fibers will damage your guts, but consumption of starch will be okay, and also some like lactose can be used as food for beneficial bacteria like lactobacteria. So this again, you have to be careful, but again, you remember that it is very good. What else condition? It is quick, so short, relatively short transition time for your food. I mean, after eating, maybe no longer than 1 day, you have to remove all these products from your gut. And if you eat only carnivore diet with no this resistant starch, then you can get constipation, and also the transition time is increasing, and it is not making anything good, because increased transition time, the pathogens I use this time to produce toxins, and toxins are getting to your blood. This is why large carnivore animals don't live long. But if you look at bats are carnivores, certainly. They eat insects, but because they fly, during the flight they don't keep these excrements inside. They defecate very quick, and so it's gut transition time in bats is very short. And then you see that the chitin is used as a prebiotics, as a food for beneficial bacteria, and result is such that these bats live more than 40 times longer than mice live in the wild, more than 40 times. And it is again longevity. They are not immortal, but they don't age. If they are killed by predation or they because of accident or infection, it can happen. But again, I was talking about this in my previous video, so decide yourself. But I believe that this is a way to live, and it is easy. I was talking about this very cheap medications. It can be helpful also as a use of antibiotics, like a combination of doxycycline, azithromycin, and with vitamin C or melatonin also can help to remove this senescent cells. So again, and stay away from plant-based food. This is absolutely important. Again, even humans, if you check people who lived long, what did they eat? They didn't eat plant-based food. Yeah, no, they were eating boiled fish and boiled beef. That's all. So if you want to live longer than 100 years, again, it is possible. But to live forever young or to live 1,000 years, you need more than this. Okay, more than this. Okay, thank you for your time. Again, please mind to subscribe to my channel if you want to support it, or you can donate. You can support it financially. Then you will get more information. I will get more time to work for you, and also I can talk with people who donate, who help me, and discuss. Some people participate in the project, and it is very good help for me, and also because I need some interaction with people. Discussing of problems with people, it stimulates me to go into deeper research. Okay, thank you for your time again. Have a wonderful day. Ciao, ciao.